that are worried, stressed, just concerned whether they're receiving the correct Social Security benefits. Well, this channel is definitely for you. My name is, if you're new to us, my name is Ed Weir. I'm a former district manager. I ran the third busiest Social Security office in the country. And before that, I worked for the Department of Social Services doing Medicaid. And many moons ago, when I actually had less hair, I was a sergeant in the Marine Corps. So I am here to help you get all of your benefits and money. So this is what this channel is all about. And so today we're going to talk to you about this resource, and we're going to make Social Security easy for you. And we're talking across the board: Social Security retirement, early retirement, delayed retirement credits, disability, survivor benefits, spouse benefits, child and care benefits. Some of those ones you're probably, what is child and care benefits? Exactly. That's what we're here for today. All right, so I'm also going to be doing a live Q&A. As most of these, I do a live Q&A. So I'm going to make Social Security easy. I'm going to show you the new resource that you now have available to you. That should take about 15 or 20 minutes. And then I'm going to open it up for a live chat. If you're watching this recorded, just make sure you watch that first part there, and then come back if you have any questions. Make sure you subscribe, because if you don't have questions now and you're like, well, next week you might, your brothers or sisters or relatives might have a question. And then with all the social media, it's always hard to find someone once you move away from our channel. All right, so let's talk about it. Why is it so difficult? Why isn't Social Security easy to begin with? Well, number one is there's over 20,000 pages of policy, and the Social Security, it's called POMS. There's over 20,000 pages of it, and it's you can actually go on the internet and go on to SSA.gov and type in POMS, POMS, and you can see all 20,000 pages. And every single day they come out with the new updates and new changes and emergency messages, and it's just, yeah, it's as I always say in these videos, there's exceptions to the exceptions to the exceptions. And so it's too much information. You've spent all your life doing your job and raising your family. You shouldn't have to go get a PhD in Social Security. My PhD is in something else, but I did work for the Social Security Administration for a couple of decades, and I did read through every page of the 20,000 pages. So it's always fun. And since 1935, so the start of Social Security, you used to be able to go to the Social Security Administration and ask them your questions about retirement or disability or survivor benefits and all the rest of it. But as many people out there can attest, they go, if they're able to get in at all, or they get the phone picked up once they call the 800 number, quite often they get different answers, different people. One of the problems is during the whole COVID thing, a lot of people, quit. And then they took an early retirement for some reason. It's interesting. They asked me if I wanted to take an early retirement, or they asked people throughout the country where they wanted to take an early retirement. And I was ready to do something different. So I said, yeah, sure, I'll sign up. So I took an early retirement. And about a week later, they contacted me after I left and said, did you change your mind? Do you want to come back? That's how, strapped they are for staff. And they are still very, very understaffed. And even if they, Congress decides to give Social Security, 10,000 new employees, those employees won't be effective for about 2 years. It takes a year or 2 years to train a Social Security employee, because there are 20,000 pages. So that's one of the problems is you walk into an office and the people at the front line are CSR, customer service representatives. They are, I would argue, the hardest working, the lowest paid, but also the lowest in terms of knowledge, because they have to be, masters of everything, or jack of all trades, masters of none. And quite often people go to the front windows and ask a question and they're told something incorrect and they walk away and that's it. So they've just lost benefits. What they need to do is talk to someone in the back, the claim specialist, but quite often they can't get an appointment. They're giving incorrect information. There's so much incorrect information out there in social media, TikTok and YouTube and everywhere. There is a company that gives you, after 2 days of training online, they give you a cute little certificate that you're a Social Security expert. And then people pay for this little certificate, several $1,000s actually, and then they go out into the world and give out incorrect information to a bunch of people, because you just can't get information on 20,000 pages and all the different exceptions to the exceptions in a couple of day online seminar. So there's just unfortunately, yeah, just too much misinformation out there, and Social Security, unfortunately, is not able to help. And what kind of examples we're talking about? Well, if the regulars to my channel know, during the live Q&As, all the money we found for people. I just talked to someone yesterday. They were given incorrect information that they could only file for auxiliary child and care benefits at 62. So they believed that, went on their way, and could very well lose money. And you're saying, what is auxiliary child care benefits? Exactly. People contact me all the time and they say, well, I can't file for ex-spouse benefits because the ex-spouse hasn't filed yet. That's incorrect. Independently entitled divorced spouse. People contact me all the time and says, well, I can't file early because I made over the annual earnings limit this year. They don't know about the monthly earnings test for the first year. So that's just 3 examples of many, many, many other things out there that, yeah, people don't get the correct information on. And when you go to Social Security, you might get misinformation, and you don't know the questions to ask when you're there. Again, I'll be fair to the Social Security employees. They're extremely inundated. You go into the lobby, and again, mine was the 3rd busiest office in the country. You go into the lobby and you ask a question, something that affects your entire life. And there's 100, 200 people in the lobby, and that person, has about 2 or 3 minutes for you, something that's going to affect your entire life. So it's important to make sure you get it right. So there's 3 ways we can help you. Obviously, go through all the videos. I've done over 300 videos so far, on all things Social Security, Medicare, Medicaid, retirement, disability, all the rest of it. Over 300 videos. So go through all the videos, and I'm doing new videos. I think I'm on my 22nd or 23rd day of a new video live Q&A every single day. So I'm going to keep doing that as long as I possibly can here. Another way is to join my free live Q&A, which I'm about to start here in a few minutes. So the live Q&A, you just type your question into chat, and I take all questions, and we'll see what we can do to get the benefits and the money you are entitled to. So that's completely free. And then I also do a very, very, very limited amount of private consultations, and that helps support the channel and all of the the phones and all that kind of good stuff. So if you're interested in that, and in terms of Medicare plans, because by popular demand, so many people have gotten incorrect information on all that, even though Part A and Part B is part of Medicare, and you sign up for that at Social Security. Everything else that kind of dovetails and covers the gaps of Medicare, those are private plans. So I've seen so many people get incorrect information there from private insurance agents. I just got frustrated and said, you know what, I'm just going to put together my own team. So I've got a team of network partners throughout the country that can help you with Medicare Advantage, Medicare supplements. And I make no secret that I always recommend Medicare supplements if it's in your budget. Yes, let's see here. I'm just checking the chat, and we've already got a bunch of questions in there in chat. All right. So yeah. So the idea of this channel is to get you the correct benefits now. If you're currently receiving benefits, we're going to make sure that you are receiving the correct amount of benefits. I just did a video, was about a week ago, on the 6 ways you can kind of confirm you're getting the correct benefits. And if you're about to file for retirement, disability, anything like that, spouse benefits, survivor benefits, we're going to make sure you do the right thing, because I can guarantee you the government, the Social Security Administration, all of it, they're not forgiving. If you make the wrong decision at the wrong time, that will most definitely affect your benefits for the rest of your life. So it's very, very important that you make the right decision at the right time. All you have to do is read the comments of any of my YouTube videos, and you're bound to see someone say, I wish I would have known this 5 years ago. I wish I would have known this 10 years ago. I wish I would have known this last month. And so there are so many of those, and I am going to keep being here and help you out and make sure you get everything you're entitled to. All right. So if you don't have any specific questions today, again, check out my the YouTube. It's under, all you have to do is Google Ed Weir, Dr. Ed Weir, or type in my Gov Expert in Google or YouTube, and it'll immediately pop up, and you can go through my entire library of 300 plus videos, and then find the one that's specifically for you. Watch it, and because there's always exceptions, you'll say, okay, that answers 90% of my question, but I have one little question based on my particular situation, and that's what the live Q&As are for. So come on back here for a live Q&A, and make sure you subscribe and like so this goes out to more people, and share it with everybody that you know, friends, family, coworkers, next door neighbors, all the rest of it. Okay, let's go ahead and get right into it. So we're going to start answering some chat questions. Let's see. Okay, we got, all right. Okay, let's see. Is it true that you can't receive Social Security and SSDI together? Okay, SS, so yeah, SS is Social Security. So you're probably meaning SSI. So SSI is the welfare-based program that's a supplemental security income, and that is incorrect. So you can receive SSI and SSDI together, and there's millions of people that do. What it basically is, if you, when you go in to file a claim, and if you're filing a disability claim, this is very important information for you. If you're recently filed a disability claim or about to file a disability claim, what happens is that the claim specialist has to address both programs, Title II and Title 16. Title II is the SSDI, which you actually paid FICA for. SSI is the welfare income-based program that Social Security also administers. And so the claim specialist has to take a claim for both. But if your SSDI, what you actually paid into Social Security, if it's over $1,000, that means you're automatically ineligible for the SSI benefit because that income would put you over. So what they'll do is they have to address the SSI. So they will take a claim for the SSI, and it'll immediately be denied because you're going to make more on SSDI. Okay, and you'll get a letter in the mail about a week later, and it says you were denied. And what the claim specialist should have done at Social Security is say, okay, you're going to receive a letter in about a month, in about a week or so, and it's going to tell you you're denied. On the top, it'll say supplemental security income. So you were denied for that program. We're continuing on with your SSDI application. Okay. But if your SSDI, you're only going to get like $500 from it, then they do both. They get you SSI and SSDI. So they bring you up to the higher level, depending if you've got, $1 million in the bank, then obviously you're not going to get at the SSI, but millions of people get SSI and SSDI. So that's not an issue. Millions of people do. And same type of thing. People get Medicare and Medicaid. In California, they call it Medi-Cal. And yeah, a lot of people don't realize that you can get Medicare and Medicaid. If you're able to get Medicaid, they will actually pay for your Part B premium. It's called the Medicare Savings Program. So yeah, if you have Medicare and you're having difficulty paying for that, the monthly Part B premium, the $174.70, then reach out to your Department of Social Services in your state and ask them to pay for it, and they'll do their thing. And yeah, see if they can get your paid, and you get a lot of other cost savings as well. They pretty much cover everything, and then you're eligible for. See how this goes. This is why the government is so difficult, because okay, you have to be eligible for this, and you got to go to this other agency, and there's just not a one-stop. Well, we're a one-stop shop here, but all the other government agencies, you have to go here and you have to do this and apply for this, and you have to make sure they also add this other thing on here. And yeah, so anyway, so Medicare and Medicaid, you tell Medicaid to pay for your Medicare, they pay for it, and then you're what's called dual eligible. Dual eligible. So you have Medicare and Medicaid. Some people call it Medi. And then you're eligible for what's called a Medicare Advantage plan. And those are the cases I definitely recommend the Medicare Advantage because you get all kinds of different benefits from it as well. Those are the ones you see all the crazy hyped up, Facebook posts about, get your $1,000, grocery card and all that kind of stuff. The government is clamping down on those because they're just, kind of a bait and switch type thing. But they are legit. There are flex cards out there. There are grocery cards out there. It's just that you've got some unreputable insurance people out there that pick the best one in the country and then advertise it to everybody, and then you call them up from a different part of the country and they got you. Hey, I call them for that $1,000 grocery card. Oh, it's not available in your area, and then they do the hard sell and all this other kind of stuff. So all right, Suzanne, if your doctor feels you need a scooter, does Medicare pay for a portion of the scooter? Yes, absolutely. There was, yeah, with the scooters, you probably saw there was a scooter company out there that was really taking advantage and doing a lot of fraud and, getting scooters to pretty much everybody to have Medicare. So Medicare has kind of clamped down on that. So you have to jump through a little bit more hoops to get it nowadays. Again, just like everything else, people ruin it for everybody else. But yes, absolutely. You get your doctor to write a prescription, and if you have original Medicare and a Medicare supplement, then that's the difference between Medicare Advantage and Medicare Supplement. With Medicare Supplement, you still have original Medicare, and what the doctor says goes. If Medicare covers it, then that's it. End of story. Medicare Advantage, you've kind of given up original Medicare, and you have to go through that company. So you have to ask permission from that company to do whatever the doctor tells you. So the doctor doesn't have kind of the final word. The insurance company does. So that's why I always recommend a Medicare supplement rather than a Medicare Advantage. But if you can't afford the monthly premium for a Medicare supplement, then that's a reality that a lot of people deal with. And so if you have to do a Medicare Advantage, then you just make sure you do the right thing and check it on a regular basis. All right. Okay, Suzanne, how can I find out I'm 78 and my disease is worse and because it's almost difficult to walk? Yeah. So, okay. So that was, yep. Let's see. Victoria, I'm currently on SSI, applied today for divorced widows benefits. The new amount will disqualify me for Medicaid. Can I qualify for Medicare before the age of 65 as a 61-year-old unmarried widow? No, unfortunately. Yeah, so if you're going to get more money because you're now eligible for surviving spouse, divorced spouse, same thing, then unfortunately, yeah, Medicare doesn't start until you're 65 years old, unless you qualify for disability. If you qualify, but you're 61 years old and you're on SSI, so you're probably disabled. So, but you're 61, so you can't apply for disabled widows benefits. Disabled widow benefits are from 50 to 60. Yeah, so I would reach out to the claim specialist that you're taking the divorced widows benefits and see in your particular case if they can adopt the disabled decision specifically for Medicare, even though because you've been determined to be disabled. So I think you might be able to, I don't know, check with, there's so many details on there. So I would reach out to the person that took your divorced widow's claim, the claim specialist at your local Social Security office, and say, hey, here's the deal. I'm going to make too much money. I'm going to get kicked off of Medicaid, and I don't have health insurance until 65. But I have been determined to be disabled. So what can be done? Will I get Medicare early? But unfortunately, probably not, because you have to be on disability for 24 months and you have to be on SSDI disability for 24 months. But like I said, there's an exception. And there's So I would definitely reach out to them. It doesn't look good though, unfortunately. So you'll probably have to do something like Obamacare, the Marketplace Health Insurance, Affordable Care Act, whatever you want to call it. Get that until you turn 65. Catherine, hi. How does widows pensions? I'm on SSDI. How does widows pension? So you're probably asking, what about widow's pension if you're on SSDI? Yeah, so widow's pension are from Social Security. Are we talking about the surviving spouse benefits? If you're receiving some surviving spouse and SSDI, then you'll be what's called duly entitled, and it shouldn't be an issue, and you'll get both of those. User. Okay, all right. So he is asking about quarters of coverage. If I make 6,900 or from July to August, doesn't matter when you make it. You can make a quarter of coverage this year is $1,730. If you make $1,700 on and $30 January 1st, you get that credit. If you make 1730 the next day, you get another credit. If you make 1730 the next day, you get another credit. You get the 1730 the next day, you get the last credit. So you got 4 credits, but you can't use those credits until that particular quarter, even though you've earned them all within a week. So you've earned all 4 quarters in a week. You can't use that quarter, the second quarter, until the actual second quarter. You can't use the third quarter until the actual third quarter. So it's confusing, isn't it? But that's why you got me. So you can earn all 4 quarters in one day, but you can't utilize them until that particular quarter. So if you're, for instance, if you're full retirement age right now, and you can, technically, retire right now, but you've only got 36 quarters, you go ahead and, pay $10,000 into FICA. So you got your 4 quarters, but you can't start your benefits until October 1st, because that's when you'll get your 40th quarter, October, November, December. So Carol, I'm 66 and not at my FRA yet, which is this November. Okay. Was that a follow-up to another one question? Okay. Richard, for those about to file, we salute you. I like it. Okay. Don Ricky, in another podcast, you said if you're on SSDI, it doesn't matter how expensive of a house you own. If you sell that house and eventually buy another, would it make a difference? What about a new car? Okay, so yeah, with SSDI, doesn't matter. Again, SSDI. Hopefully you meant to write SSDI and not SSI. If it's SSI, yes, it does matter. But an SSDI, it doesn't matter. You could, have, $10 million homes, and it wouldn't affect anything. It would actually, well, you'd have a lot of money, but yeah, that wouldn't affect anything. If you're receiving, well, it would affect one thing. If you sold those homes and you had Medicare, you would be charged an extra premium. A lot of people are amazed, they're surprised that they're receiving Medicare, and then they're 60s and 70s or something, and they decide to sell the family home and downsize to something smaller, and then 2 years later they get this IRMA letter, which is an extra premium, and they said, hey, 2 years ago you made a whole bunch of money, and therefore you're a high wage earner, and so we're going to charge you a whole bunch more for your Medicare Part B premium every single month. And everybody always freaks out. I did make that. It was just a sell of a house. For some reason, Congress did not carve out that allocation, that exception. So if you made, $300,000 2 years ago working, or if you made $300,000 selling your house, Social Security, the Medicare Part B premium looks at it exactly the same, unfortunately. But you only have to pay that for 1 year, unless you sell a house the next year or something. So yeah, so now, yeah, if you're on SSDI, it doesn't matter. And unless, of course, you sell a house and a car and stuff like that, because that's your job. So you're a realtor or you're a car salesman and that's what you do, is you have a business selling houses and selling cars, then it's your income, then you're working, and then it does affect SSDI because you're receiving disability, and Social Security defines disability as the inability to work. And now if you're working doing your job, which is selling homes and cars, then they just might kick you off. Joe, can my wife collect half my FRA if I reach my FRA and am still working and not collecting? No. Also, must she be at her FRA? Okay, no, you have to collect. That was an old policy. They started in 2016, where you could do what you're thinking about doing, but you can't do that anymore. So she has to file. So if she is not working, I just did a video on this a couple of days ago. It's called the split strategy. Make sure you watch that. But long story short, she goes ahead and file for her own benefits, starts getting her money coming in. And then when you file and start your benefits, then she can file a spouse claim off of yours and get up to half of what your full benefit amount is. So I would definitely watch that video to make sure you're not going to be losing any money there. Because sure, if she files on her own, sure, hers will be reduced, but once you file and she files on yours, then it'll be jumped up. So whatever it is now that she files, however it is, it's going to be jumped up later. So it might be a good idea to start getting her money now while the getting's good. That's what a lot of people do. So watch my video. It gives you a little bit better explanation of all of that. All right, Carol. Does the ex need to have been receiving Social Security to receive ex-spousal benefits? I'm waiting until November, my FRA month, to start receiving the maximum amount based on his. His FRA was November 2023. No, that is, every time I think about all the tens of thousands, hundreds of thousands of people out there that are not receiving benefits because Social Security doesn't do a good enough job notifying people of this. It's called independently entitled divorced spouse. And I've done a video on that one too. I've done a video on pretty much. No, I don't think I was about to say I've done a video on everything, but there's a million exceptions. So I will have enough content for until they come out with a cure for male pattern baldness. But anyway, yes, independently entitled divorced spouse. Basically, you do not, the previous spouse does not have to have filed. So as long as the previous spouse, your ex-spouse, is 62 years old, then you can file for, first you have to file on your own. So you file for benefits on your own record. And then if their benefit amount is over half yours, and again, make sure, a lot of people make this mistake, is they look at their checks that they're currently receiving and they say, hey, Bob, hubby Bob, let me look at your check. Oh, yours is not as twice as much as mine. That's not the number you go by. It's the PIA, the primary insurance amount. So call up Social Security and they can give you the PIA for yours and the PIA for your husband's, ex-husband or whoever, and they will be able to tell you whether there's any money there. Don't just look at that's called in internal Social Security. There's the PIA and there's the MBA. And the PIA is the primary insurance amount, how much you would receive at your full retirement age. And the MBA benefit amount. And it could be lower than your PIA, or it could be higher than your PIA. And you're like, how could it be higher than your PIA? DRCs, another. So many acronyms, even when I was in the Marine Corps, so many acronyms. DRCs, delayed retirement credit. So your PIA is how much of your full retirement age. And if you wait to collect benefits after your full retirement age, you get those delayed retirement credits, 8% tacked on to your benefit as long as you wait every year. So 24%. So if your PIA is $1,000, if you wait till you're 70, now you're going to get $1,240. So, your previous spouse does not have to be collecting benefits for you to apply. As long as they're 62 and you've been finally divorced from them for at least 2 years, then file. Please, please. And please, everybody, please press like and subscribe and share. I almost guarantee that there's someone around you at your workplace, your kids, your uncle, or coworkers, or place of worship, wherever. I guarantee you, there's someone around you that are not getting the correct benefits or about to file and stressing whether they're going to get the correct benefits. And so please make sure you share, and they will be forever grateful to you. You will be a true life superhero. Let's see. Maggie, if I am receiving disabled survivor benefits that split with my disabled son turning 63, how could I request my own benefits without interruption to my current benefits? Okay, so you're receiving disabled survivor benefits, DWIB benefits, and your son is also receiving benefits on his late father's record, and you're turning 63. Yeah, you can definitely request. So if your benefit amount is above what your current benefit amount is, then you could very well switch over to your own record, to your own work record. But I wouldn't do it if it's not more than you're currently receiving, because even if it is a little bit more, I probably second guess taking it, because if you're receiving, let's say, $1,000 from disabled widows benefits from your deceased spouse, you're receiving $1,000, and you said you're 63 years old, and if you switch to your own record, it's $1,200, and you're like, oh, okay, $200 more. If you need that $200, then yeah, absolutely go for it. You have to worry about Medicare, whether Medicare is going to make sure you check on the Medicare issue, but $200 more. But if you wait and just stay on the lower survivor benefits, that $1,200 is going to keep going up, because it goes all the way up until your full retirement age. And again, delayed retirement credits. So it could be, $200 more, but next year it could be $300 more, or next year $400 more. So that is a number you need to figure out. So you call Social Security Administration and say, hey, how much my benefit on my own record? And they'll tell you. And then you ask them, says, okay, if I wait a year, how much is it going to be? And then you say, thank you very much. And you sit there and think about it for a day or two. And if you want to go ahead and file, then you call them back and say, okay, yep, I want that extra $200 or $300 or whatever the case may be. Set me up an appointment. But then in your particular case, I would definitely check about Medicare. I'm not sure when your Medicare started or anything. But yeah, in terms of interruption of benefits of your child or your son, that's independent. So that's not an issue. Catherine, how does widow's pension work? I'm 60 on SSDI. Ooh, that's a big question. It just basically, yeah, if you're sick, okay, you're on SSDI and you're 60. So now you're on SSDI, you're on your own record. And now you turn 60, so you're eligible for a surviving spouse benefit. And so same type of situation I just talked to Maggie about. So you call up Social Security and you kick around the numbers and say, okay, I'm receiving X amount right now. If I go ahead and switch to widow's benefits, how much is it going to be? And then you make that determination if you need the extra money, or if there is even extra money. And then obviously, again, part B is you ask them about Medicare. How is that going to affect my Medicare? Not sure when you started your Medicare. So yeah, ask them about that, because that's a whole different ball of wax. And that's an exceptions to exceptions to exceptions. John, what's up, John? So if you get SSDI, you still can claim SSI. Absolutely. If you're receiving SSDI and you don't already have SSI, that's someone at Social Security made a mistake. If you're qualified for it, but if your SSDI is over $943, then you can't get SSI. So because the max you can get on SSI is $943 this year. So what happens is, in California, it's a little bit different. California gives you an extra supplement of a couple of $100, I think. But yeah, it's basically if your SSDI is $500, they give you that $500 on SSDI plus another $443 from SSI. So you get SSDI and SSI. But if you're making, $1,000 from SSDI, yeah, you can't get SSI. Kathy, what's up, Kathy? My Social Security earnings record is extremely short for 2012. How do I get a copy of my 2012 tax return so I can begin to correct this? Yeah, that's an IRS thing, but you go on the IRS website and they call it what is called a transcript, I think is the name they use. You get a transcript and it'll tell you the specifics. But if you're not exactly sure of, you want a little bit more detail, the Social Security has details too of exactly who you work for that year. So you can also reach out to Social Security and get, if you haven't already, because online it doesn't give you a whole bunch of super details of, what job you worked and the name of the company and stuff like that. You can get what's called a DEQY, DEQY. It's a detailed earnings query for that particular year. And I would get it like 2011, 2012, 2013. That way you can, see what happened about that time. But be very careful. Again, there's so many new employees at Social Security. If you go on there and ask them for that, you ask them for your work history, they will try to charge you, which is not bad because that's what they're supposed to do. But because most of the people that come down to Social Security asking for a work history like that are people that need a background check for work. Like if, someone's applying for the police department or something like that, the police department requires them to go down to Social Security and get a work history for the last 10 years of where they worked so they can do their background check. And Social Security has determined that that's not what Social Security's job is, to give out background check information. So they charge for that. It's crazy. It's like 2 or 3 pieces of paper and they charge like over $100 for that. So Social Security is making some good money on that. But if you ever go in there and request that, they're going to say, okay, it's going to be $120. And you say, no. This is, remember these words, program related. Program related. Program being you're filing for retirement benefits or you're already receiving retirement benefits and you just have a question. You've done the correct thing by checking your earnings and you want to make sure you're receiving the correct amount. This has nothing to do with some background check. This is something to do with the Social Security retirement program. So it's program related. And if they say it doesn't matter, you still be in charge, then that person doesn't know what they're talking about. And you say, can I speak to your OS, your operation supervisor? And they can correct that person. Carletta, my FRA is 66, June 2024. Would they add up my last work earnings, which is 2022? I'm currently getting SSI and SSDI. My FRAs, would they add up my, okay, yeah. So if you're getting SSDI, you don't have to do anything because if you're receiving SSDI, then disability, you will automatically be switched to retirement at your full retirement age, and your check and everything will stay the same. And if you did work and did pay into Social Security, and that's one of your high 35 years of earnings, then yeah, they will, as soon as you do your taxes and notify the IRS will notify Social Security of how much you made last year, and Social Security will automatically do the calculation. So if it's one of your high 35 years, they'll kick out a low one, put the new one in there, recalculate, and give you your extra money. And that's 100% automatic. You don't have to do anything. KJV, question, if SSDI is determined by the jobs from the last 10 years, but earnings were higher in 10 years before that, would Social Security retirement amount be increased more than SS? No, it's basically over kind of, they do all that, depends on how old you are, of how they calculate how much your disability benefits are, how much you actually paid into the system. So your disability amount is estimated based on your full retirement age. So if you're 55 years old and you pull up your statement and it says, okay, if you're 55 years old, here's how much you will receive at your full retirement age. But the earnings records, myssa.gov earnings records, those are estimates, because if you're 55 years old and you look at, okay, when I'm 67 years old, here's how much I'm projected to receive from Social Security retirement. But don't take that as a definitive number, because if you're on disability at 55, you're probably not going to work the same amount you've been doing recently. Because what Social Security does on those statements, and they say, okay, you made $50,000 last year and about the same last year or the year before that. So we're going to project that you're going to continue working about the same amount until you're 67. From 55 to 67, they kind of plug in those numbers, and that's how they figure your future benefits. I get calls all the time and says, "Yeah, I got my statement. I'm sitting here. It's my statement from three or four or 5 years ago, and it says I was going to get this much, but now I got my check and it's like two or $300 lower." And the first question I always ask is, "Did you stop working or reduce your work?" "Oh yeah, retired, decided to travel the world." "Oh, there you go." So Scott, I'm 35-year-old. My 35-year-old son who lives with my wife and receives SSI. When I start FRA in 2 months, does he receive half of that? Yes, absolutely. Up to half. If there's other people on the record, then there's a family max involved. But if he's the only one on the record, somebody sent me a comment today on my YouTube chat, and they said, "How come nobody talks about family max?" I'm like, "I talk about family max all the time." Yes, absolutely. And it might take a little bit longer. Hopefully, what they do is, so you'll go ahead and file for benefits at your full retirement age, retirement benefits, and then when you call and schedule and tell them you also have a child, disabled adult child, that needs to be converted because your son is already receiving SSI based on a disability, but Social Security disability, SSDI, which he'll be switched over to, that's a little bit different. So what they'll have to do is they'll probably have to send it back to the DDS and all that kind of good stuff. But if it takes them a month or 2 months or 3 months to convert it from SSI to SSDI, you won't lose money because they'll give you, whatever the difference is for however long it took them to make the decision. So yes, and then same thing. I'm sure you're already the representative payee for your son, and so that'll just count over. But yeah, if there's no other kids or anything on there, then it'll be 50%, and then if he pass away, he'll receive 75%. And auxiliary child and care. All right, so let's see. Lives with wife. So lives with your wife. So ex-wife sounds like. They are eligible for what's called auxiliary child and care benefits. So you probably already know about this. It's basically if you're taking care of a number holder, you're the number holder. The child is receiving benefits from your record. If they're taking care of that child, natural mother there, and not working or staying under the annual earnings limit of this year's $22,320, then she can receive child and care benefits, which basically, as the name implies, she has a child in her care. And the reason she can't, theoretically, the idea of the program is one spouse has to stay home to work to take care of the child under 16 or a child that became disabled before the age of 22. And so Social Security, okay, that's something that we want to, support. So they give that person money, and they get 50% as well. So that's where the family max comes in. So 50%, 50%, and there's only a certain amount of money that can be paid out on the record. If there's only two, then it should be good. Yeah, so she will, if the child is living with her and she's the representative payee, then what happens is you have to go ahead and file for retirement on your own benefits and then tell her, "I just filed," schedule an appointment or do it at the same time, schedule it like, the same day or something. You file in the morning and then she files in the afternoon for disabled adult child benefits and investigates the child and care benefits as well. So good luck on that. Victoria. Thank you, Dr. You're welcome. Thank you, thank you, thank you. All right, let's see what else we got here. Penelope. Oh, looks like Penelope is answering other people's questions. I like it. I got a community. You would have to collect on your own Social Security first in order for your wife to file for spousal. Yep. All right. Someone responded in one of my YouTube comments that they said regular viewers of my channel, of my videos, probably know more about Social Security than some of the people that work at the front windows at Social Security. Uh, and I hate to say I kind of agree with that. I, so I won't say that. But anyway, all right. Let's see. What's up, Jerry? Jerry Garcia. I will turn 65 on November 1959 and will file for Social Security benefits July. How much can I earn in 2024 after I filed to not be taxed? 2 for 1. Okay. Yeah, it's technically not a tax, but it's a withholding. All right. So you're going to be 65. And you're going to we'll file for benefits in July. So you're going to start your benefits in July. Okay. So let's say you start your benefits in July. Up until June of that year, this year, whenever, you can make $1 million a month. So you can make $1 million, $10 million up until June. But the first month you start benefits, that first year, the first month you start benefits, you have to stay under the monthly limit. And this year it is $1,860, which is basically $22,320 divided by 12. So as long as the first month you stay under 1860 and stay under that amount, you can collect your benefits and they won't withhold $1 for every $2 you go over. So whether that's the first month is August or September or October, whenever the case may be, the first month you go under 1860 and stay under that month is when they will start your benefits. And next year you can't do the monthly thing again. Next year it's the whole year. So yeah, so you'll probably be 66 all next year. So next year is not your full retirement age, because once the year you hit your full retirement age, there's different numbers in there. Victoria, how long after application date does it take to get survivor benefits? Not very long at all. I've done a few 100,000 survivor benefit claims. And as long as you've got everything, all the proofs are in, marriage certificate, divorce decree, the death certificate has already been proven Social Security. So that's not an issue. So yeah, if you've got all the proofs and everything like that, and once they push the button, adjudicate the claim, it, pretty quick, a week or two to whenever, if I've had them, check sent out the next day, essentially. So Betty, Dr. Weir, I'm FRA, retired 2 years ago. If you go back to work full time, are they going to take SSI dollars from my checks? Okay, SSI, that's the welfare program. So if you go back to work, absolutely. But you don't mean SSI. And is my retirement check going to increase after I quit the job? Okay, all right. So I assume you mean not SSI, because that's the welfare-based program. You mean retirement. Okay. All right. So if you're FRA, so you can go back to work and make $1 billion, and then you're gonna buy me a coffee in the bottom there once you make your $1 billion. Yeah, so you can. They will not take anything from your benefits. You are not subject to the annual earnings limit at all. Once you hit your full retirement age, you can make all the money in the world. And the second part of your question is, will that affect your Social Security benefits in terms of making it go up? If that's one of your high 35 years of earnings, so last year you made a really good money, and it's one of your high 35 years of earnings, you file your taxes, the IRS notifies Social Security, and Social Security looks at everything and see if it's a high 35, recalculates, all automatic. You don't have to do anything. So if that's the case, you get 2 bumps next year. You get your COLA and you get your recalculation because it's a high 35 years. So, all right. Do I have to wait and receive widow's disability after my survivor benefit is finished? Because my son will be 16 soon and I am 50 with disabilities. Do I have to wait? to receive widow's disability. Well, you have to, yeah, you have to wait because anytime you file for disability, yeah, unfortunately, there's a crazy wait period. I used to tell people when they file for disability, yeah, you should get an answer in 3 to 6 months, but everything has changed, and now I hear people or the Social Security employees are saying 6 to 9 months because it just takes forever. So you are currently receiving survivor benefits based on a son that was under 16. You were receiving the child and care benefits. There you go. Um, and because your son will be 16 soon, you can no longer receive child and care benefits because the child has to be 16 or under or disabled before the age of 22. So did I say that incorrectly before? That it has to be under 18? The child will, I don't think I did. I think I said it correctly. The child can get benefits off a parent's record up until they're 18 or they graduate high school, or 19 in a couple of months if they, goof off in high school. But a child in care benefit, you have to have a child in your care 16 and under, or that became disabled before the age of 22. Okay, I just want to make sure that's clear in case I incorrectly said 18 before. Okay, but so you were getting child and care benefits, surviving child and care benefits, and now the child is going to be 16, so your benefits are going to stop. So you also are disabled, and you're going to file for disability benefits, and you're wondering which you can file for disabled widows benefits from 50 to 60 years old. So it looks like you're doing the right thing there. Yeah, so yeah, you're gonna have to wait because it's a disability claim. So they're gonna have to go through the whole thing and watch I did 3 or 4 videos on disability, how to file, and tips, tricks, and secrets, and all that kind of good stuff. Make sure you watch that to give you a better leg up on getting approved. But yeah, I would file immediately, if not sooner, because it's going to take months and months and months for them to get you approved. Don Ricky, 83 watching, only 50, only 15. I can't see the likes on this side, so y'all are hooking me up here. Y'all are taking care of me. I appreciate it. Yeah, why aren't people pressing like? Everybody press like. Yeah, like. When you press like, that teaches the algorithm that y'all like it, so they send it out to more people, and more people get the information they need and get the money they definitely need. Overjoyed, if you marry after 65 but maintain different addresses, will it raise red flags with Social Security if you claim spousal benefits? Um, yeah, I'm not. Yeah. I mean, yeah, there is no red flags or anything like that because marriage is a county type thing, and they don't notify Social Security. But so I know there's no red flags there unless someone drops the dime on you or something like that. But yeah, but if you're legally married, then you're legally married. So whether y'all decide to live together or not, that's not an issue. Unless you're on SSI, but you're 65, so you could. But you're talking about spousal benefits, so there is no spousal benefits in SSI. So, good time. I am 50 on disability. Would I be eligible to receive my ex-wife amount if more than mine, or does she have to be 62? So she has to be 62. Yes. And she has to be 62, and then you can file for spouse benefits when you are 62, 12 years from now. So check out the numbers at that time. But most people don't want to go off disability because there'll be Medicare issues and all the rest of it. Let's see. My husband and I are both at full retirement age. He is collecting his benefit. I want to wait until I'm 70 to claim. I'm 67. Can I file for spousal benefits without filing for my own benefit? No, you cannot. They changed that back in 2016. But is his benefit twice as amount as yours? But it sounds like it probably not. Your sounds like your benefit amount, if you're doing everything right, your benefit amount is probably the same-ish. So you are waiting for your delayed retirement credits. And so, yeah. But be advised that a lot of people get this wrong, including Social Security employees, unfortunately. One of the problems with Social Security employees, they talk about, but my old coworkers, is when they first start the Social Security, again, a couple of years of training, and they know it, they know what they know, and they know this type of stuff about delayed retirement credits and, all this kind of different stuff. But then for the next 20, 30, 40 years, all they do is they put it in the system and they push the button and the system does everything, and they forget all of the information that's underlying that. So I've talked to a bunch of retired Social Security employees, and I've talked to them about delayed retirement credits for spouses and surviving spouses and stuff, and they completely they've adjudicated hundreds of thousands of those, but they forgot kind of the nature of those. So I've been trying to find someone to kind of help me out, because I get tons of questions that I'm just not able. I just don't have enough time in the day to answer everybody's questions on comments and emails and stuff like that. I've been looking for other retired Social Security employees. Number one, everybody's like, no, I never want to talk about Social Security again in my life. And number two, the people, it's hard to find people that actually still know about Social Security. So in your particular case, be advised that those delayed retirement credits, when you file, for spouse benefits, and you look at the two amounts, if your husband or you benefit amount includes those delayed retirement credits, the other spouse doesn't get those delayed retirement credits. Okay. The only time you get delayed retirement credits is on a surviving spouse claim. So a surviving spouse can get those delayed retirement credits. A living spouse cannot. So let's face this. All right. Question. My aunt didn't file for taxes. Didn't file for taxes. If this is a tax question, I can't do it. So didn't for 2 years because income was less than 5,000. If she files 22 and 23 taxes now, will Social Security credit her for those 1 or 2 credits for those years and include those in calculating fraud benefit amount? Okay, all right. So that's not a tax question. That is a Social Security question. Awesome. Okay. Yeah. If that's another thing. People always ask me about taxes, and I'm like, yeah. But sometimes they do directly affect Social Security. All right. So, but the question is, yes, if she does that and she can get her extra 1 or 2 credits by doing that, absolutely, she'll have to pay the taxes on that. And then once she does all that, rectifies all that with Social Security, or excuse me, IRS will notify Social Security, and then she'll get her credits. But the next question I have is, does it matter if she's already getting benefits? Where is she getting those benefits from? So if she's getting from spouse benefits, if her benefits increase, it doesn't matter because she's already getting the higher spouse benefits. So if she's getting $200 from hers and $300 from a spouse, then hers might go up to 25, and this will be reduced by 25. She'll still get the total amount. So I would figure out whether it's worth going through all that nightmare for something that's not going to make a difference. So, but it doesn't look like she's insured at all. So she's receiving any type of Social Security from a spouse or surviving spouse. Her getting extra money won't make a difference because she'll be duly entitled, and the total amount will be the same. So I would check that out. I was told that I cannot get widow's disability benefit yet, not until the survivor benefit is finished when my son turns 16. Is it true? Yeah, because the timing. Yeah. I mean, you can withdraw your auxiliary child and care. So you can say, okay, well, I want to go ahead and get this thing started. So I want to go ahead and file. So you can file, 1 or 2 months before your son turns 16, before you're kicked off. So you can get you have that window. So you can technically do that. But yeah, I don't know about the, waiting to lose benefits before you file another one. They should allow you to go ahead and file for disability. So you can get the process rolling. So I would definitely check on that. That doesn't sound correct. Penelope, Sheila, Social Security will require you to take your own. Okay. People answering other people's question. Good community here. All right. Judy, I was getting SSI and SSDI when I got married. They cut my SSI off because my husband was drawing Social Security. Is this correct? Yes. I only get $433 on SSDI and I'm still disabled. Yes, because SSI is a welfare-based program. So if you're receiving that, if you're receiving SSDI and SSI like you are, and then let's say you get married, and so your husband's income gets figured in there. If you win the lottery, you get some money, inheritance or something like that. SSI is a welfare-based program, so they immediately say, okay, you got money coming into the household. However it came in, it's coming in the household, and therefore you're not entitled to the welfare-based program. You're still disabled because you're receiving SSDI. That doesn't matter. It's the it's income, resources, and you can't get SSI if you have a lot of income and resources, or even some. Lot is relative, right? Overjoyed, second marriage, divorce, less than 10 years before the age of 60. Am I disqualified from receiving any benefit from first marriage if he croaks? All right. Am I disqualified from receiving benefits from first? No, no. If you have, you go into Social Security at 60 or 62, and you have 2 or 3 ex-husbands, deceased or living, or whatever the case may be, then it's the Social Security employee's job to ask you about all of them, all 3 of them. Okay, were they 10 years or longer? Okay, okay, you had 3 10 years or longer. So then the Social Security employee has to go through each one of those. They have to look up the Social Security number, look up the benefit amount, write it down. Okay, $1,200 on this one, next one $1,300, next one $1,100, and they say, okay, the first one looks like there's more money there. Let's go ahead and get you money on that one. So, yes, that doesn't disqualify you that you've been remarried since. Savannah, I wish my mother had known about SSI when she was getting her disability pay, a $500 a month. We had no idea she might be eligible, and that's what she lived on for 15. Yeah, yeah. That's, again, unfortunately, the remark. But so please like and make sure that doesn't happen to anybody else's mother or father, or, uncle or aunt in your community. So please share and tell everybody about the channel, and so we can help out other people in your mother's name. Right? Overjoyed. I wish I knew about all this in my 40s. It would have informed my choices versus marriage and divorce. Yeah, a lot of people, they get divorced, and some spouses or ex-spouses are tricky. They know that the 10-year rule, and maybe they don't tell you. And I just had one last week in the comments, and they pushed it through, and so it was like 9 years and 11 months and something, and they did that on purpose, even though it doesn't affect them at all. That's the weird thing. I think it's just out of spite, because that's another thing, is you got a lot of people out there, again, probably somebody that or someone that that knows someone else, that is saying, okay, I don't want to file for my ex-spouse benefits because I hate that person, or I don't want that person to know, or that person is remarried. I don't want, to affect their benefits. None of that is relative. They won't know, and it doesn't affect their benefits. So a person that, tricks you to get you divorced early, just out of spite, because you getting benefits 30, 40, 50 years later won't affect that person's benefits. So KGV, thank you. Your videos are very helpful. I appreciate it. Thank you. Thank you. Thank you. Prophets, hey, from Georgia. What's up, Georgia? How we doing? All right, let's see. Prophetess, husband passed away before was getting $500. Wife applying for SSI. She will be 60. Husband been gone for 8 years. She never received child and care benefits. Yeah, yeah. Again, so many people. One of the things about child and care benefits is, I think I talked about the family Mac. I think I talked about it, but it's always good. If you've got, and I've seen this too many times, every time you see an accident, fire or car accident or something, young, mother or father passes away, within a week, that family, the kids go into the Social Security Administration. And that's one of the tough things about working at Social Security, is you immediately see that. And then the young family comes in and you've got two children that you have to take, claims for surviving child benefits, and they'll receive benefits until they're 18, until they graduate high school. But if you have a child in care, if you've got three people that are going to collect benefits, then they divide it amongst the three people if there's a max limit, that family max. So sometimes it doesn't benefit to take the child in care benefits if it's going to reduce the other ones. So but at the very least, the Social Security employees, when you go in there, they should tell you that and says, okay, you could be eligible for child and care benefits, 50% or 75%. However, it's going to do this or that to the other, kids on the record. And then you make the decision at that time. So, all right, Cynthia, Dr. Ed, I applied for the Medicare Savings Program. I have no idea if they received my documents. I mailed them. Yeah, so you applied that through your Medicaid office, right? The Social Services Department, Social Services Department, Welfare, whatever they call it in your area. So yeah, the Medicare Savings Program, awesome. So you have Medicare, and you may have Medicaid, or you haven't had Medicaid, and you ask them to go ahead and pay for your Part B premium. Awesome, awesome. And there's different levels. There's QMB and QI and Slim B of different Medicaid, depending on the state, depending on your income and resources and all the rest of it. They might just approve you for Medicaid without paying for your Part B, or they will approve you for the higher levels of Medicaid and pay your Part B. So that's a beautiful thing. And if you get that one, then give us a call. Call your insurance agent that helps you with Medicare, or give us a call, and we can find you a Medicare Advantage plan. It's called a dual eligible. Some extra benefits there, possibly depending on your particular area. So, Lady T, I am on disability, but I turned 60 in September. Can I file for spouse support? I will transfer to retirement in September 2024. I was married 10 years. Yes, you can do that. If you've been receiving disability for a while, you can definitely switch to survivor benefits at 60. You have that right, but is it the right thing to do? Is it, because you can receive survivor benefits, and if it's considerably more, that just might be a very good option. But again, check about Medicare and see what they're going to do with Medicare. Are you going to lose your Medicare, and now you have to wait till you're 65 to get your Medicare, and all the rest of it? So yeah, definitely check that out. I've been completely ignoring TikTok here because I need 10,000 subscribers on TikTok so I can get you all those questions here. Let's see. I get paid every second Wednesday of the month anyway. You can get it changed to the first. Changing the pay date. It used to be possible, never easy, but possible. But it looks as though, because the Department of Treasury is the one that decides, the pay date, and they would basically go by your date of birth, your day of birth. If you're born the first 10 days, then your pay date is the second Wednesday of the month. If second 10 days, third Wednesday of the month, last of the month. And we used to be able to do it. If really hardship, you're getting charged $200 extra every month because of, you're late on your rent or something like that. So we were able to change it, but I've been told by a few people that, they pretty much stopped that. So, if you were able to change it recently, please let me know, because a lot of people aren't being able to change it. Okay, so I applied for disability. Do I get widow's disability or mine? It depends on which one you applied on. If you applied for disabled widow's benefits between the age of 50 and 60, then you would get that. If you applied for disability on your own record, then it'll be on your record. Does capital gains from a housing and capital loss from the stock market affect IRMA if it's equal? The housing, definitely. Capital gains, again, that's all kinds of different variations there, but definitely the house. If you're collecting Social Security off of your deceased husband, can you get widow's benefits too? Those are widow's benefits. So surviving spouse benefits, widow benefits, widower benefits, they're all the same thing. My ex-husband receives SSI. I'm going to get my SSI in a couple of months. Can I get part of his SSI? SSI is the welfare-based program, and that is 100% no. But I know you mean Social Security. So yeah, regular Social Security retirement is, yeah, if he's already filed, then you can file for benefits on your own record. And if his benefit amount is twice yours, then absolutely check it out and get that started if you want. Uh, can I get benefits for taking care of my husband? He has Parkinson's disease. Not from Social Security. Um, there's nothing from Social Security like that. So I would definitely reach out to, state, county services, and they sometimes have some type of program like that. If he was a vet, definitely. And there's also a lot of counties and cities, they offer respite care as well. That try to obviously see if you can get some money from whatever local agency, and then also respite care. It's basically they send someone in there, however regularly, so you can take a kind of little break, because on all those it's usually tough on the caregiver as well. I've been tapping here and I don't see you're answering. Yeah, sorry about that. I'm not answering too many TikTok questions. I'm sorry about that. My sister was married to her partner who is deceased. Would my sister be able to access his benefits? Absolutely. If she's disabled between the age of 50 and 60, she can get surviving disabled widows benefits. If not, then she can get regular survivor benefits starting at 60. So, all right. My friend is getting a divorce. Her husband has been married 3 other times. Who has his benefits? It could be all of them. It depends if they were all married for 10 years or longer, and one doesn't affect the other. So if that person, and I've taken them before, married 3 times, and 3 ex-spouses come in and file for benefits, one does not affect the other. Could you imagine that if Social Security did that? As like someone is married to this, let's say this guy, there's 3 ex-wives, and then the second one comes on, that reduces the first one, and the third one comes on, reduces the first two. I mean that is Social Security could get sued for something like that, because those ex-wives are going to go out there and do something bad to those others so they can increase their check. So Social Security is not, doesn't want to do that. Have you all out there, have a, Hatfield and McCoy type situation going on. So yeah, one doesn't affect the other, and that's why you'll never know. And the ex-spouse will not know either of that 3 people filed record benefits on their record. That's none of their business. That is a benefit you earned being married to that person for 10 years. So so it has nothing to do with them. All right. Sorry, TikTok, I've been ignoring you here, but please, yeah, if y'all subscribe, I need 10,000 subscribers, and that way I can do y'all right here. So add you into. I've got YouTube, I've got Facebook, I've got LinkedIn, I've got Twitter, all coordinated in here, but TikTok is very stubborn. Does the SSA process 100% PT veterans quicker? Hopefully you watched the video I did yesterday. I just did a video yesterday on exactly your question. But usually not because you're a veteran or anything like that, and not because you've already been determined disabled by the Veterans Administration. It's more because Social Security has quicker access to Veterans Administration medical records. That's the only reason. So, but if you're a veteran and all of your medical records are outside the VA, then it takes exactly the same amount of time as anybody else. but the VA and the Social Security Administration computer systems kind of talk to each other, so that will make it easier. Is the 5 years look back to a divorced husband for Medicaid? Okay, so you're talking about a 5 year look back. So the 5 year look back type thing, yeah, not a divorced spouse. Yeah, that's not an issue for Medicaid or anything. But the 5 year look back thing is usually what that is a lot of people are getting estate planners, attorneys to put their resources in an irrevocable trust, and that way when they get sick and need to go into a nursing home, the state Medicaid will pay for that. But when you pass, your state can go after your house and take your house. So if you wanted to leave your house to your kids or something like that, sorry, the state's going to take it. However, if you put that into it, protected it, but it has to be protected 5 years prior because the state does have 5 year look back. So if you did it 2 years ago and then went into a nursing home, racked up $1 million, and then died, then the state can come take your house. But if you did it 5 years ago, then they can't. So that's why a lot of people are doing that, and that's where the 5 year thing came up. Mark, definitely check out my video yesterday. Perfect. Let's see here. All right. All right. So we're at an hour and 20. So I'll do a couple more questions. Oh, got a donation from LJ. Awesome. Super chat. Thank you. Got my coffee money for the day. I appreciate it. My wife is older than me. Does she have to wait until I file for Social Security before she can file? Okay, so yeah, no, if she can file on her own, but she can't because you're currently married. She can go ahead and file on her own, but you have to file before she can get spouse benefits off of you. If you were divorced and married for at least 10 years and all that kind of good stuff, then yeah, you didn't have to file. But since you're currently married, then yeah, you have to file first. All right. Wow, we got tons of questions here. Holy cow. All right, let me do a couple more here. When husband passed, can wife get benefits for taking care of adult disabled child on SSI? Again, not on SSI, only on SSDI. All right, let me get some questions from people that haven't asked yet. Karen, what's the difference between widow and survivor benefits? Exactly the same, just different names. I'm about to file FRA for my deceased husband. SSA wouldn't answer my question. I need to know where I am going to get the most money. Yeah, they're the same exact thing. Survivor benefits, surviving spouse benefits, widow benefits. Yeah, same exact thing. All right, new people here. Jan. Oh, Quicken is CC asked, what is FRA? That's full retirement age. Yeah, sorry. Sometimes, yeah, we throw out acronyms too much. So it's a full retirement age. Your FRA, your full retirement age is, like anybody born in 1960 or over, their full retirement age is 67 years old. In the old days, it was 65, but in the 1980s, they changed the law and they gradually increased it. So yours might be 66 and 8 months or whatever the case may be. Okay, Jan, what is required to substantiate common law marriage? Former wife died and I'll be 60 in 2 years. We were together 15 years, bought a home together and went, okay. It's the state. Whatever the state decides, Social Security has to go by that state. So not all states recognize common law marriage, but if you happen to be in a state that does, then you just go to local Social Security Administration and you file a spouse claim, divorce claim, whatever kind of claim you're looking at. And the people, if you're still in the same state that has a common law marriage, then I'm sure all the employees, the claim specialist that's going to take your claim knows about the state regulations on exactly how to prove common law marriages, because all marriages are, local. So the federal government has to recognize them if they're actually valid marriages, and the local government, state, county, or whatever determines what is valid. And some states do recognize common law and some states don't. So, yeah, so whatever your state says. And again, Social Security has to abide by that. So I wouldn't, I wouldn't go above and beyond and go get a whole bunch of documents unless, you go to the state website and you see what they require. But make it easier on yourself. Just go to Social Security and they'll tell you exactly what you need. So that way you don't spend a lot of money getting stuff that you don't might not need. So, Janelle, my child was diagnosed disabled as a child. She's receiving SSI. Will she be able to get Social Security from her dad? Absolutely. Yeah. So if her father files for disability in the future or retirement benefits in the future, then absolutely. So the child will get child disability benefits if they're young. And then once they become 18, they can get disabled adult child benefits, basically the same type of thing. Yes, absolutely. Carletta, that's why I'm not sure I will getting my full retirement credits over 24 years. I see some zeros on my earnings. Yes, yes. Yeah, quite often the zero on the earnings, a lot of people they're like self-employed in 1099 or something like that. They didn't pay into FICA, didn't file taxes or whatever the case may be. But yeah, if you've got zero on your earnings and you worked for a company, let's say in 2012, and you work for the same company 2012, 2013, 2014, and in 2013 there's a zero there. And you're like, I worked for that company that entire time, before and after. What it usually is somewhere along the way somebody they mistyped your social security number and your earnings are in what's called a suspense file. So they're sitting out there in limbo for someone to raise their hand and say, hey, those are mine. So it's very, very easy. If that's the case, you go in there and say, yeah, it's a 0 year, but you can see I worked for the same company the year before and the same company the year after. So the Social Security employee will look at the EIN, the employer identification number, and say, oh, okay, yeah, here are the earnings. Oh, okay, yeah, it says, yeah, Carletta Sims. Yep, that's your name. And oh, yeah, it looks like they, instead of 1 2, they typed in 2 1 on your Social Security number. That's why it's been sitting in the suspense file, and then they go ahead and put it on your earnings record and they recalculate your benefits. And if you fix something like that and you catch it like 5 years later, and that increases your benefit by $10, let's say, they will go back all the way and said, okay, yeah, we should have been paying you $10 extra for the past 5 years. They will go all the way back and pay you all that money that they owe you, going all the way back. COLA increases and all that kind of good stuff. But all right. So let's see. My question is, I applied for disability. Will I get mine or deceased husband benefits? Again, what depends. Were you just on TikTok? You jumped over here. No problem. It depends, yeah, whether you applied for yours or a deceased husband, whichever one you applied for. I've been waiting for almost a year. I've applied last year at 58, now 59. Next month, I'm at 73%. Okay, yeah, that 73% thing. Yeah. Yeah, Social Security, I like their effort, A for effort on when you file for disability, you go onto mysocialsecurity.gov and you look in there and it shows you, where you're at in terms of the progression of your claim. I like that they did that, but it's just like anything else. When you're downloading something from the internet and it says, 10%, 20%, 30%, and all of a sudden it says 80%, and then it goes back to 20%. So it's kind of like that. So I wouldn't go to the bank on 73% what it says online. But it sounds like it's already a DDS, the Disability Determination Service. It sounds like they've already gotten some medical records and they're, in that stage of, evaluating the medical records. And once that stage is over, then if they, approve it or deny it, they send it back to the local office for adjudication. So yeah. Can you ask I think I got to Lady T's question. Yeah. So yeah, I've got tons of questions today. Okay, let me do let me do one more. Oh, maybe it's Honeybee. Hey, what's up, Honeybee? Hitting the like, the subscribe button. All right. Let's see here. Oh, let me ask. if I continue to, okay, if I continue to work past 65, can I stay on employer insurance or do I have to take Medicare B? Good question. Okay, good. I've got a video lined up for that one this week, and I found of I'm always thinking of the thumbnails of the videos, always trying to get more people to watch so they can get the money. I think I'm very proud of myself for the thumbnail I've got for this one coming up here in a couple of days, maybe tomorrow or the day after. But anyway, so it's about this question. No, if you have employer health insurance through current work, yours or your spouse's, and that plan, that group plan, your employer has 20 or more employees that have that, then no, you do not have to sign up for Part B. You can, you know, once you get your card, you can, keep Part A. If you're not giving to an HSA, a health savings account, you can keep Part A and then just refuse Part B, save yourself the $174 because, why waste that money if you don't need it? And then once you stop working and stop receiving insurance from current work, your work or your spouse's work, then you legally have 8 months to sign up. But I would do it like a month or two before you're going to stop. And that way, one insurance stops one day and the first day of the next month, your Medicare starts and everything. And then you have to figure out, how you're going to cover all the gaps of original Medicare. I applied for SSDI and it told me that it would take 222 days to give me an answer. I've never heard anybody saying that, but a specific number of days. Yeah, I think someone just messing with you. Nobody knows. It really depends on a lot of variations. I've, taken claims and their claims approved today in the same day. If, stage 4 cancer and, different stuff like that. Mental disabilities take longer. Back issues take longer. Fibromyalgia takes longer. So it really depends on the nature of disability. And the person, the claim specialist that took your claim is not a doctor. I'm not a medical doctor. So yeah, what they're supposed to say is, you'll get an answer within 3, 6, 9 months or so. So yeah. All right. So I think that is about all I can do for one day. All right, let me do Karen. I am confused. Should I receive widow or survivor? Again, those are exactly the same thing. Yeah. Yeah. Widows or survivor benefits are exactly 100% the same thing. So potato, potato, tomato, tomato. Right. So, all right, that'll be it for today. And yep, I'm on day 23 or 24, 25 of doing this every single day. So tomorrow I'll do the same thing. I'll come up with a topic and then we'll talk about that for 10, 15 minutes. And then I'll do a live Q&A. So I sincerely apologize if I didn't get to your question today. Please join me tomorrow and I will get it tomorrow. All right, y'all take care. Have an awesome